Hi, everyone. We just wanted to talk about some of the new coronavirus implications for Canadian group benefit plans. The two things I want to talk about are first travel insurance coverage and then other contingency type plans that you might need for your business. So first of all, we know that businesses are hurting. Businesses are feeling the pinch, and this is a very difficult time for Canadian businesses. Justin Trudeau just a couple hours ago just said that they're closing the border to any non-Canadians, so no non-Canadian citizens or permanent residents, and that can be scary. We also saw that Green Shield Canada just released a statement. So if you go to support.greenshield.ca and click on coronavirus, they released a latest statement, and I'm just going to read a snippet of it, but it's important that if you're a Green Shield covered plan member in your group benefit plan that you visit this website, read it as well, support.greenshield.ca, and then click on coronavirus. So first and foremost, we, Green Shield, strongly encourage you to review the official Government of Canada travel advisories, with the March 13th advisory stating to avoid non-essential travel outside of Canada until further notice. In terms of Green Shield specific information, you should read your own contract, but then reading further, in light of the new Government of Canada advisory to say avoid all non-essential travel until further notice, Green Shield will not cover any travel emergency expenses related to the coronavirus, COVID-19, whether incurred on a cruise or any other type of travel. I'm going to read that again. In light of the latest Government of Canada advisory to avoid all non-essential travel, Green Shield will not cover any emergency travel expenses related to the coronavirus, COVID-19, whether incurred on a cruise or any type of travel. However, unrelated incidents, such as a fall, accident, heart attack, could still be considered subject to the terms of your plan. This position now applies to all destinations globally. For more details on traveling at this time, please check the latest advisory. What does it mean for coverage if I'm already away from home for non-essential travel outside of Canada and left prior to the government advisory, but the advisory status has changed since I arrived at that destination? They're saying, more importantly, refer to the Government of Canada Travel Advisory website, travel.gc.ca, which includes the recommendation to find out what commercial options are still available to return to Canada and consider to returning to Canada earlier than planned if these options are being more limited. Where there are no options to return to Canada at this time, if your travel coverage will expire while stranded in an area under quarantine due to the trip day limit, or a limited coverage period, and you left Canada prior to applicable government advisories, Green Shield will extend the emergency medical coverage until the end of the period of quarantine, including for coronavirus-related claims. If you are stranded beyond the planned return date from your trip in an area under quarantine, Green Shield will allow reimbursement for meals and accommodations for the additional unplanned days up to the amount included in your benefits plan, assuming you left Canada prior to the applicable advisories being issued. If you left Canada after the applicable advisories were in place, travel coverage will not be extended, and Green Shield will not cover any emergency travel expenses related to the coronavirus. However, unrelated incidents would still be considered subject to the terms of the plan. What should I do if I experience coronavirus symptoms ahead of upcoming travel? Keep in mind, per the Government of Canada advisory, all non-essential travel should be avoided, and that Green Shield will not cover any emergency travel expenses related to the coronavirus. As with all pre-existing medical conditions, you may not be covered for medical treatment if you experience symptoms prior to traveling. Please refer to your benefit booklet for more conditions on pre-existing conditions or being stable to travel. So I'm not going to read the entire policy. There's still another page, but I think it's very important, if you are a Green Shield covered customer through Beneplan, that you visit support.greenshield.ca and click on coronavirus. There's a couple other considerations we wanted to share. We know that the cooperators are also working hard to update their travel statement. Last week, as of March the 12th, they released a statement saying that if you are traveling to any countries with a level 3 or level 4 advisory, then that would not be covered. However, I know that they're updating their policies as we speak. So I think really, in effect, what we're trying to say is the interpretation of all of this is do not travel. If you can avoid it, please stay home. Travel insurance companies are updating their policies daily at this point, and you do not want to be caught in an area where you're not covered. Some other considerations I wanted to share with you. Really, this is the time to use your insurance advisors, use their creativity, use their connections, use their vendors. If you are struggling or if you need help, please reach out and ask. There's lots of different solutions that your insurance partners can think of for you. You have lots of insurance coverage that you might not even be aware of. So please do reach out for any situations you need help with. business continuity, or any pandemic survival, we're here to help. We also have a great partnership with Maple Telemedicine. So Maple is a great Canadian telemedicine platform that Beneplan has a unique discount partnership with. So if you're in a situation where you need telemedicine for your company or you or your loved ones, please do reach out. We're happy to help set up an account for you. Regarding Beneplan, so our own team has been told to work from home. We are able to work from home, and phone lines have been routed to people's home lines. Now, if somebody's calling you back, they're going to be showing from a private number or an unlisted number, so that could be why that's happening. We have also changed our annual general meeting. On April 22nd, we were supposed to meet in person, and we have just changed that to being an online-only format. So we'll be able to support online voting, online polling in a way that's secure and time-stamped. We also are trying to expedite and move up the payment of dividends to the cooperative members as soon as possible. We're going to be moving towards a direct deposit model this year, given all of the considerations, because we know that companies are hurting, and this is a time when companies need dollars as soon as possible. Regarding childcare considerations, some employers do have childcare benefits and childcare coverages in their plans. If your plan doesn't have this coverage right now, but you would like to implement some sort of childcare benefit, you can reach out to your insurance advisor as well, because we know that parents, caregivers are struggling through this situation. And then short-term disability. So Beneplan is noting that all insurance carriers that pay for short-term disability are updating their policies to mirror the new employment insurance sickness benefits waiver of the waiting period. So there were some notices recently last week saying that if you are sick due to the coronavirus or any sort of symptoms, you have to be in self-quarantine. If you're not able to get to a doctor, there are ways where you can shorten the waiting period and self-report the symptoms. That said, there is a really great online tool. There's a self-assessment tool from the Ministry of Health. We'll post that later on our blog, but you will be able to check and see. And then finally, I'm going to share the two phone numbers of our insurance partner call centers. Their call centers are working around the clock. It's possible you might be waiting in line, but I'll share them anyways. The Green Shield call center is 1-888-711-1119. And the Cooperators call center is 1-800-667-8164. And then finally, Beneplan can be reached either at 416-863-6718 or 1-800-387-1670. Again, we're all working from home, so you can reach out to us, send us an email, send us a text, and we're happy to help. So we know that businesses are hurting right now. We know that the borders are closing. Your insurance partners are here to help. There are lots of creative solutions we can help businesses with at this time. And please reach out if you need anything. Thank you so much.